Parkinson's is a neurodegenerative disorder that primarily affects movement. It is characterized by a gradual loss of dopamine-producing nerve cells in a specific part of the brain called the substantia nigra. The exact cause of Parkinson's disease remains unclear, but researchers believe it involves a combination of genetic and environmental factors contributing to the development of the condition. Exposure to certain toxins or environmental factors can increase the risk of Parkinson's disease. Pesticides, herbicides, and certain metals such as manganese have been studied as potential risk factors. The progressive degeneration of neurons in the substantia nigra leads to a depletion of dopamine, causing the characteristic motor symptoms of Parkinson's. It is known for its distinctive motor symptoms, which typically develop gradually over time, with tremors being the most common of these symptoms. This involves shaking, usually starting in a limb, and often occurs while at rest. This is commonly referred to as pill-rolling tremors due to the rubbing movements between the thumb and fingers. A sufferer will typically experience slowness of movement and difficulty initiating these movements. This is known as bradykinesia. Simple tasks often become progressively more challenging and time-consuming. Stiffness in the muscles leads to reduced flexibility and a limited range of motion. This rigidity can cause discomfort and pain. In addition, sufferers will typically experience impaired balance and coordination, which can result in difficulties maintaining posture and an increased risk of falls. In addition to motor symptoms, there are a number of non-motor ones that can be looked for. Handwriting typically becomes smaller and more cramped, known as microphagia. A reduced ability to detect or identify odors is common, as is a general loss of smell, known as hyposmia. Sleep disturbances can occur, which include insomnia, restless leg syndrome, and reduced eye movement or REM sleep behavior. Emotional changes and mood disorders also occur and include depression and anxiety. Digestive issues such as constipation can arise. Speech can often be softer and lacking in variation. In addition, the most common symptoms include problems with memory, thinking, and reasoning, especially in later stages. The shortage of the neurotransmitter dopamine leads to muscle deregulation, as this neurotransmitter plays a crucial role in facilitating smooth, coordinated muscle movements. One of the hallmarks of Parkinson's disease is the accumulation and clustering of a protein called alpha-synuclein. These clusters form structures called Lewy bodies, which are found in the brain cells of individuals with Parkinson's. The presence of Lewy bodies is associated with neuronal dysfunction and eventually cell death. Increased levels of oxidative stress, which occurs when there's an imbalance between free radicals and antioxidants in the body, may also contribute to the damage and dysfunction of neurons. Dysfunction in cellular energy production within mitochondria is observed in Parkinson's disease. Impaired mitochondrial function can lead to increased oxidative stress and contribute to neuronal damage. The immune system and inflammatory responses in the brain are believed to play a role in disease progression. Chronic inflammation and activation of microglia, which are immune cells in the brain, are believed to contribute to this neurodegeneration. Whilst most cases of Parkinson's disease are sporadic, without a clear genetic cause, certain genetic mutations have been identified as risk factors. Mutations in genes like SNCA, LRRK2, PARK7, and PINK1 have been linked to familial cases of Parkinson's, although these cases represent a small percentage of overall diagnosis. Parkinson's is more common in older adults, and the risk increases with age. Most people diagnosed are over 60 years. Men have a slightly higher risk of developing Parkinson's disease than women. In addition, traumatic brain injuries or repeated head injuries have been suggested as potential risk factors, although the relationship is still not fully understood. Some studies have suggested that individuals living in rural areas or those involved in farming might have a slightly higher risk of developing the disease, possibly due to increased exposure to pesticides and herbicides. Parkinson's diagnosis involves a combination of clinical assessments, medical history, and sometimes specific tests or investigations. Whilst there's no definitive test, several approaches help in confirming the diagnosis and ruling out other conditions that might present similar symptoms. A neurologist typically evaluates the individual's symptoms, medical history, and performs a neurological examination to assess motor function, muscle tone, reflexes, and coordination. A positive response to Parkinson's medications, particularly levodopa, can help support the diagnosis. Improvement in symptoms after taking these medications can be indicative of Parkinson's disease. Imaging tests such as a DAT scan are often used. This involves injecting a small amount of radioactive tracer that binds to dopamine transporters in the brain. It helps visualize dopamine transporter levels, assisting in distinguishing Parkinson's from other conditions causing similar symptoms. Blood tests are usually used to rule out other conditions, such as thyroid disorders or vitamin deficiencies. MRI or CT scan imaging techniques are not used to directly diagnose Parkinson's, but they might be employed to rule out other neurological conditions or to evaluate the structural changes in the brain. In certain cases, genetic testing might be considered, especially when there's a strong family history or suspicion of a genetic form of Parkinson's. The treatment of this disease aims to manage symptoms, improve quality of life, and slow the progression of the condition. Treatment plans are usually tailored to each individual's specific symptoms and needs. As discussed earlier, levodopa is one of the most effective medications for managing motor symptoms. This drug gets converted into dopamine in the brain, supplementing the low levels of dopamine. In addition, one can use dopamine agonists, as these mimic the effects of dopamine, helping alleviate symptoms. MAO-B inhibitors and COMT inhibitors help prolong the effects of dopamine or inhibit the enzyme that breaks down dopamine in the brain. MAO breaks down dopamine to 3,4-dihydroxylphenylacetoaldehyde, or DOPAL, which in turn is degraded to form 3,4-dihydroxylphenylacetic acid, or DOPAC, by the action of the enzyme aldehyde dehydrogenase. Physical therapy can help improve flexibility, balance, and mobility. Exercises designed specifically for Parkinson's patients can be beneficial in maintaining motor function. Deep brain stimulation, or DBS, involves surgically implanting electrodes into specific areas of the brain. These electrodes deliver electrical impulses that help control abnormal brain activity and alleviate symptoms, especially tremors and motor fluctuations. Lifestyle modifications can also help. A healthy diet, regular exercise, and adequate sleep can support overall well-being and may help manage symptoms. Speech therapy, occupational therapy, and support groups can provide valuable assistance in coping with the challenges of Parkinson's disease. Medications or therapies might be prescribed to manage non-motor symptoms, including depression, anxiety, constipation, sleep disturbances, and cognitive changes. Parkinson's disease is one of the most common neurodegenerative disorders, and its prevalence increases with age. It's relatively rare in younger individuals, but cases of early onset Parkinson's can occur. Nearly 90,000 people in the United States are diagnosed with Parkinson's each year. In the UK, 1 in 37 people alive will be diagnosed with Parkinson's in their lifetime. This means that the lifetime risk of being diagnosed is 2.7%. In the UK, 153,000 people are already living with the condition. The UK has organisations and support groups dedicated to assisting individuals with Parkinson's diseases and their caregivers. The National Health Service provides care and support for people diagnosed with the disease, offering access to medications, therapies, and specialised care. One prolific sufferer of Parkinson's is Michael J. Fox, perhaps best known for his role as Marty McFly in the Back to the Future movies. In 2000, he started the Michael J. Fox Foundation, which seeks to advance scientific progress towards finding a cure. In fact, he is perhaps as famous nowadays for his advocacy as he was for his acting. As the disease progresses, over time, Motor symptoms such as tremors, rigidity, bradykinesia, which is slowness of movement, and postural instability tend to worsen, leading to increased difficulty in performing daily activities. Individuals with Parkinson's may experience fluctuations in their response to medication, leading to periods of improved mobility, known as on periods, and periods of worsened symptoms, known as off periods. Some individuals experience freezing episodes, where their feet feel as if they are stuck to the ground, making it difficult to initiate walking or causing sudden halts whilst doing so. Problems with memory, cognition, and concentration deteriorate over time. Moods become more erratic, sleep becomes more disturbed, and dysregulation with blood pressure and urinary problems start to appear. It can also lead to changes in speech, causing reduced volume, slurred speech, and a monotone voice. Swallowing difficulties arise, which can increase the risk of aspiration and pneumonia. Postural instability and impaired balance increase the risk of falls, leading to injuries and fractures, which can further impede mobility and independence. In addition, long-term use of medication can lead to side effects, including involuntary muscle movements and hallucinations. In severe cases, Parkinson's can progress to dementia, affecting memory, executive functions, and overall cognitive abilities. This has just been a very brief overview of Parkinson's disease. If you wish to learn more, then I will include all of my references in the description below. Thank you very much for watching.